Do you offer any products specifically for people with diabetes? And if so, just tell me about the sort of conditions that someone with diabetes might experience.
Diabetes actually in the UK, it does have a huge burden on the NHS. It is estimated that there are about 4.3 million people with diabetes in the UK and an estimated 850,000 with undiagnosed diabetes. So those who are not even tested or are aware they have diabetes. Now, there are various complications that occur with uncontrolled glucose levels or uncontrolled sugar levels in their blood. That could be diabetic nephropathy, diabetic neuropathy, or diabetic retinopathy. When you talk about diabetic neuropathy, it's talking about the sensation to the nerves. So, for example, you may have heard of diabetic foot ulcers. Those tend to be quite a big risk in cases of uncontrolled diabetes. And when you have diabetic foot ulcers, for example, you then have the wound exudate leaking onto the surrounding skin, which, as I mentioned before, the periwound. So when the wound is continuously leaking onto the surrounding skin, you then have what you call periwound maceration. So there's a breakdown of the skin surrounding that wound. And research has shown that if you heal or treat the periwound well, you are more likely to heal the wound. You also have cases of diabetic foot ulcers and then resulting in amputation. But if we ensure that the periwound and the wounds are healed, and of course, their blood sugar levels are controlled, then there's less likelihood of amputations. So for periwound maceration, I will come to periwound maceration because our products are not used for the diabetic foot ulcer or the wound itself, but they're used for the periwound. Medi Derma-S barrier film, which I would say is the go-to product. So if you're in doubt, Medi Derma-S barrier film is the product to go to because that can be used in any type of moisture-associated skin damage. So you would apply the film around the wound, but before you do that, you would cleanse the exudate or any dried bodily fluid with our Medi Derma-PRO foam and spray incontinence cleanser. So the cleanser actually is a no-rinse cleanser. You apply that onto the surrounding skin. You leave it for a few seconds, and then you wipe it gently. And then you apply the Medi Derma-S barrier film or the Medi Derma-PRO skin protectant ointment if the damage is more severe on the periwound skin. So that's where we talk about Medi Derma-S barrier film and Medi Derma-PRO skin protect. They are the barrier products. But with wounds or diabetic foot ulcers, you also have dressings which some other companies manufacture, and these dressings are applied on the wound per se. So when these dressings are being changed, again, I would say refer to the Lifties Medical Adhesive Remover, which is our brand, and where you actually ensure that the dressing comes off more gently without discomfort and with reduced pain on removal.
No, I see. What's the likelihood, say, if you've got a loved one suffering from these conditions, that if you speak to a nurse or a doctor and the nurse or doctors are aware of the skin integrity issues, what's the likelihood that those professionals are going to know about your products or similar ones?
I think one of the big things is driving awareness of moisture-associated skin damage, the various types of MASD. So through our advertisement, through our social media platforms, we continue to do that. However, nurses, community nurses, district nurses, care home staff, I think we are probably some of the companies which are responsible for driving that awareness amongst them. And there was I'll just refer to a paper back in 2017, 2018. There was a paper by Julian Guest, and that talked about the burden of wound care on the NHS and the wound care burden being about 8.3 billion. So a huge burden, and a lot of the integrated care boards, ICBs, or the previously used to be called clinical commissioning groups or PVPs, they do have targets and KPIs where they have to reduce the damage of MASD. They have to reduce the prevalence of MASD within their ICBs. So that awareness is increasing. I won't say everyone is aware, but nurses, definitely tissue viability nurses are very specialized and they know about moisture-associated skin damage, and they will inform the GP to prescribe the relevant.
Interesting. What questions should a family ask before considering purchasing these products?
Yeah, I think one thing I would say is always get the advice and a prescription from your healthcare professional, that your GP or your nurse, the nurse can give you the advice and the GP can give you the prescription. So once you have the right product for the right level and the type of moisture associated skin damage, then some of the questions I would say is, how do you use the product? How do you apply it? How thin should the application be? When you're applying, you need to wait for a few seconds. Do you wait for 5 minutes? So find that information. Once you've done that, how frequently do you need to reapply that cream or the ointment? What are the precautions they need to take? For example, some of the products can have flammability warnings on their product. So if the patient or if the person is a smoker, what advice do you provide to them? Because you do not want that product to become a hazard, a health risk for that person. And I think mainly just keep your nurse or your community nurse informed how the skin has improved. And if it hasn't, then there's a step up. Say if you have someone been started on the Medi Derma-S barrier cream, then there's a step up to the Medi Derma-S barrier film. And if you need it more for a more severe damage, then Medi Derma-PRO in protectant ointment. We have very important how-to guides, videos, cards, instructions.
What's your YouTube channel?
It's Medicare Plus. We have Nurse It, which is one of our products. It is one of our dressing packs where you are changing the wound or the dressings. And we have a video on how to use that in the aseptic non-touch technique. So without actually touching any other part, the way it opens up, it supports the ANTT, aseptic non-touch technique. And we have a video on that. We have a lot of videos on our website as well. As a community, as a healthcare provider, one of our responsibilities is to continue driving that awareness of how big moisture-associated skin damage is a challenge and how we as organizations can support the clinicians to drive better outcomes for their patients.
Brilliant. That was so clearly explained, Alp. I've learned a lot. Thank you very much. Sorry.
All right. Thank you, Luca.
And I hope to see you again soon.
Take care.